This podcast is on Botox for pain, chronic pain, acute pain, all different types of pain. Something that I've been exploring over the last few years, and it's, to me, a fascinating subject because Botox traditionally is used, everyone knows, for wrinkles. It can also help with scars and texture and tone, and I think that's probably another blog in itself because I can probably speak for many incidences of how, or indications how Botox is beneficial for the body. But I'm going to talk about specifically pain. My venture with this started many years ago. I did a facelift on a patient that had some really uncomfortable pain after the procedure, which fortunately I have not re-encountered in 15 years or 17 years now. But she had a lot of discomfort right along the earlobe, and I knew that the great auricular nerve was irritated. So I tried putting a long-lasting block in, bupivacaine or Marcaine. I tried steroids. Nothing helped. And I thought, oh, Botox may help. I put a little Botox in, and the pain was gone, never to come back again. I've had patients that have had bad hair transplants done elsewhere. I've never had a problem with chronic pain in the back of the head over 17 years in practice. But I had several patients, unfortunately, that have had nerve injuries from bad hair transplants in the past. And I just put a little Botox in that area and it just knocks it out, and usually takes 2 or 3 rounds and it's gone. I've also had my own patients, occasionally after a hair transplant, they feel a little discomfort. Probably about 2% of my patients have a discomfort right in one area. I just put a little Botox in, it just knocks it out for good. I don't have to go back and do it again. I've done Botox for migraines. And so the difference, though, with migraines is that a lot of neurologists put in a bucket of Botox all over the place. They put it across their head. They put 2 or 3 bottles in. I only put a few units in. And I consider myself like a sniper rather than a grape shot. So I'm able to go in there and just put a few units and I just knock out the nerve. My nanny had so much pain that she couldn't barely function. And I was able to put a few drops in there and the pain was immediately gone. So it is powerful. And she was off all medications. I had a staff member and a patient of mine who had knee pain where they couldn't even go down the stairs. So I put some into her knees. She goes, wow, I immediately feel better. And I said, go to my back stairs. She said, I will know if it works if I can go downstairs. I'll go home and let you know. I said, you know what? I have stairs in the back. Let's go to the back. So I walked her down the stairs. She says, I have no pain. This typically for chronic pain issues lasts a few months. And then after a few rounds, it starts to not need as much treatment. And sometimes it becomes extinguished. I don't charge a lot for it. Currently between $150 to $350 a treatment, depending on how many areas and how big an area I'm treating. So it's a nominal expense. There's no pain when I inject it with a needle. If I'm near a nerve, actually the nerve will be a little irritated. But what is so crazy, and if you ask me what is the mechanism, I actually don't 100% know. But there's instant pain relief. Another example that I always do is I inject Botox for grinding of teeth and clenching. A friend of mine had so much pain from the fact that he actually cracked a tooth that he was in so much pain, and my staff didn't know better. He texted me and said, hey, what should I do? I heard Botox can work for jaw pain. I just cracked one of my teeth, and I've been to the dentist, and my staff said, oh, don't come in to see Dr. Lamb if you're in pain. I said, no, get your butt in here. So he came in here, and I immediately injected him, and he texted me when he got home there was no pain. So there's something very unusual, because if you've had Botox for wrinkles, you know that wrinkle reduction occurs at the earliest, maybe 24 hours, and that's not even a full expression of it. The mechanism by which Botox works for wrinkles is that it blocks the presynaptic junction release of something called acetylcholine. It is a neurotransmitter or at the end plane of the muscle. So that's how we understand Botox to work. But clearly this is not a motor, it's not a muscle thing. You can still move your knees. But it's something with chronic pain that's incredibly affected well, and I don't know how it works, but it is an amazing tool that I've developed that I would say 99.9% of people out there don't even know what I'm talking about. I've never heard of it. So I've also done a triathlete who had a pain in his ankle, not his ankle, his ankle on the backside, Achilles tendon, so much so that he has to sleep with a wrap around his legs. And he said, look, I'm a scientist. I don't trust this will work. Just do one side. I said, all right, fine. I did one side, And he said, well, it immediately feels better. It must be placebo. I don't know what's going on. He drove home. He usually hurts when he drives. No pain. He woke up the next morning. No pain. So the one thing is I know that pain can be a symptom of something deeper. So clearly what I would advise you is if you have pain, go seek professional assistance for it. Whether it's a massage therapist, a chiropractor, if you believe in that, fascial release, whether it's some other indication, orthopedic surgeon, podiatrist. But if you've got chronic pain that just is not relieved because there's an irritated nerve, I could be the person to help you at very little expense with incredibly fast relief. And as I said, the relief is instantaneous. I've injected fingers with instant relief. I've injected necks, heads, shoulders, backs, fingers, toes, I think I said knees, everything. And it's just absolutely insane how quick the response is. As I said, oftentimes you just need to repeat it a few months later, but like my nanny is completely off all migraine medications. So if you're going to a neurologist getting 2 or 3 bottles of Botox and paying a huge deductible for it, you're getting way overtreated and you're missing it. I can go in there in 2 seconds, knock it out painlessly, and get sustainable outcomes at a modicum of cost. I had a lady that was spending $2,700 a year on deductibles for Botox, and she said she just decided to stop, even though she had undergone hospitalizations. And I said, look, for pennies on the dollar, I can fix it. So I injected her. She goes, wow, instant relief. So hopefully that little blog about Botox for pain is helpful for some of you guys out there.